Welcome to the State of Mind Virtual Speaker Series. This series has been developed to provide education and support to youth, caregivers, and educators during this challenging time. This series is a collaboration between two local nonprofits, 1 in 5 and MindPeace, and various community mental health partners. We're glad you're here to educate yourself and to learn how to keep your brain in a healthy state of mind.
Hello, and thank you for joining me for this State of Mind speaker series brought to you by 1 in 5 and MindPeace. My name is Julie Knueven, and I'm Director of Child and Adolescent Programs for Solutions. I'm going to be talking to you today about recognizing signs and symptoms of anxiety and depression in this time of COVID and coronavirus. First of all, I'd like to talk to you about anxiety. So what does anxiety look in small children, in elementary, and in adolescents? So anxiety in children can look a lot like just excessive worry. It seems like they're worried more than you would think is typical, or more than they usually do. It can occur in these times where we're not doing our regular routines, where they're not going to school. Things are different. And so it can occur naturally in these times. But if it starts to take control, if you see that it's starting to take control over everything, or they are worried for every day, most of the day, that's something to be concerned about. Are they showing a little bit of restlessness, or are they on edge? Are they bouncing their leg or have excessive energy? Or are they easily fatigued or not sleeping well? Do they kind of go to sleep but then wake up with some worry or need some reassurance during the middle of the night? Maybe they can't concentrate well, or they're just irritable. Sometimes children who have a lot of anxiety show some muscle aches and pains. So they complain that their stomach hurts. They complain that their legs hurt. They complain that their back hurts. And that can be a sign that they are having some anxiety. It can cause some difficulty in friendships, or maybe in their online classes. I had a couple families talk to me that it just was so anxiety provoking being on those classes that sometimes they had to end the class and talk to their child before they could get back on to do schoolwork. So if this is different for your kids, if they are showing some signs that are not typical, it may be necessary to talk to somebody else and get some help. It's normal to have some anxiety in childhood. It's normal to be anxious about a quiz or a test. It's normal to be anxious about starting school again or going to a new friend's house. Those are all kind of normal anxious moments that kids have. What I would ask myself is there a pattern with this? Am I seeing this more than I would typically see with my child? Is it every day? Are they starting to whine and cry? That can be a huge sign that they're having a lot of excessive anxiety. What happens with our young children is they're often not able to explain what they're worried about. They're often not able to form into words the feelings that they're having. So it's important for parents to talk to kids. I see that you're having a lot of energy and you're not sleeping. So can you tell me what's going on? How does your belly feel? What kind of feelings are you having? And so try to help them express what they're feeling. Try to help them explain what is going on. And you can get a better picture then about what they might be anxious about. I had one parent who talked to me about going to the grocery store, is anxious for some kids. The masks are different. They don't want anybody to touch them. And so they made a decision that maybe it wasn't a good idea to take their child to the grocery store anymore during these times because it just made them too anxious. So be aware, take those cues from kids and consider whether this behavior is normal for them or just a little escalated during these times, and get some help. You can start with your medical doctor. You can talk to your counselor at school. You can talk to your principal at school. I know during the summer, many counselors are off, but most schools still have their principals. You can also reach out to the MindPeace website to see who your mental health provider is for your school and reach out to that mental health provider to get services during the summer. For high school age, anxiety can look a little bit different. They may stay in their room. They may be on their phone constantly. They may be very anxious to get out and do things. They may stop talking to you. So I want to caution parents when kids start to stay in their room, it can also be a sign of depression. It's normal for high schoolers to want some alone time, time to think about who they are and who they want to be. But if they're spending all their time in their room alone, all of their time gaming, that can be a problem. And so consider that they might be having feelings of anxiety or depression. High schoolers also may get very snippy or very sarcastic. And so most kids have that side to them when they start to turn 13 or 14. But if it's excessive and if you see a huge change in their personality, it may be a sign that they're starting to feel some things that they just don't know how to handle. And so start to talk to them. Get back into routines. Routine is a very important thing when we have kids at home during this time of coronavirus. Making sure you still have those family meals. Getting kids involved in cooking is a huge way to get kids talking, and it teaches them a huge life lesson. So start to cook with them, get them involved, have a family game night. But be present and be available to your child and talk to them about that it's important for you to understand how they're feeling so you can help them. And sometimes we do not have all the answers. And so it's totally appropriate for you to reach out to your medical doctor or to reach out to a mental health professional. Getting into mental health does not mean that every child will be put on medications. And so for some parents, I hear that worry that they don't want their child to go on medications. So mental health does not always involve putting your child on a medication. We work with kids in regards to helping them cope with the feelings, helping them cope with the behavioral side effects of being anxious or depressed. And so we will talk with them, we will talk with you, and talk about how to help your child cope with these excessive worries or depression. Let's take a moment to talk about depression. So depression often can look like angry outbursts. And every child has angry outbursts at times. So it's kind of the degree of how much they're doing that. Are they being angry most of the day? Do they have outbursts multiple times and that just is not normal for them? Do they have a depressed mood that lasts most of the day? Are they grumpy all day, every day? Do they have less interest in things they like? Especially for teenagers. This is a huge sign for teenagers. If they've enjoyed gymnastics their whole life and suddenly they're done with it. Or they love music and they stop suddenly. That can be a sign of depression. If if they have a significant weight loss or gain. So during COVID, we've all put on a few pounds, right? But if they've had a significant weight loss or gain, or you notice a significant difference in how they're eating or how much they're eating, that can be a sign of depression. They can't sleep, or they sleep all the time. Both can be signs of depression, especially in adolescence. They may feel fatigued or just not have energy. They may want to sit on the couch the whole day. They may not be picking up after themselves. They may not have the same energy level as you're used to. They feel worthless. So they may make statements that are self-deprecating or very negative about themselves, and say things about their self-esteem that make you question. That can be a sign of depression. They can't concentrate or think. So maybe schoolwork was a problem, or even reading a book, or processing things, that they're forgetting things that they knew in the past. Those can be signs of depression. And finally, for adolescents and pre-adolescents, sometimes they have thoughts of death. And that can be really scary as a parent to hear that. But it can be a sign of depression, and it can be a sign that they really need some help in regards to what's going on in their head. So the things you can do as a parent are really important. Stay connected to your child. Know when there are signs and symptoms that you need to act on. And don't be afraid to reach out. We all need help as parents. This is the toughest job. I say to my families all the time. Besides marriage, raising kids is probably the toughest job. So ask for help, get support. And your therapist or mental health professional or doctor is happy to help support you and educate you in things you can do at home also. Find new ways to connect with your child. Do they like music? Then ask them to show you their new favorite song. Then you show them your favorite song. Maybe it's a throwback from when you were growing up, or maybe it's a current song. Those are ways to connect with your child, to start talking about feelings. Ask questions. Do not be afraid to ask the question if you feel like your child is depressed. Have you ever thought of killing yourself? There is a misnomer out there, a kind of a false statement that we shouldn't ask kids if they're thinking about that. Science tells us that it's very important to ask that question. If you are concerned about your child, ask the question. Are you thinking about killing yourself? Have you ever hurt yourself or had thoughts of hurting yourself? And then you will need to act. If they say yes, then you will need to get some help. It's a hard discussion, but kids feel so much better when they can talk about it and feel supported by parents and by others. And so reassuring your child, this is scary. I'm sad for you, but know that I will be here to support you, and I will be here to help you through this. We are a family. This is how we do this. We support each other. Those kind of statements can make all the difference in the world. And kids tell me all the time, when they can express their feelings and when someone else knows, they feel so much better. It's like a weight that's lifted off their shoulders. So don't be scared to ask those questions. We know that kids often can't say it until someone asks. So if you think your child is thinking about that, ask the question. What else can you do? What else can you do if you are worried about your children? There are many websites out there. MindPeace and 1 in 5 have great resources out there for you to look at to help in regards to the relationship with your child and helping them through anything that they're worried or depressed about. So take a look at those. Take a look at those resources that are out there for you. And thank you for spending time with me. Please remember to visit the 1 in 5 and MindPeace websites for additional resources and more State of Mind videos.
A special thank you to our State of Mind speakers and to you for joining us. More videos and educational resources can be found at 1 in 5's website. If you feel like you or your child is in need of professional support, therapists are available. Please refer to MindPeace's school-based or community resource page. For a mental health crisis or emergencies, patients and families are encouraged to contact their current mental health provider first. This allows the mental health provider who knows your child best to provide support and direction. If your child does not have a mental health provider and they are experiencing a non-life-threatening mental health crisis, you are encouraged to contact the Psychiatric Intake Response Center at Cincinnati Children's Hospital Medical Center. 513-636-4124. Call 911 or go to the emergency department if you are experiencing a medical emergency, a life-threatening mental health crisis, or are directed to go there by a medical provider. This will help limit the spread of COVID-19 in our community and allow our emergency departments to care for patients with the most critical needs first.